Hey, it's Blonde here from the Vortex Healing Center. I wanted to have a chat today because May is National Mental Health Awareness Month in the US. And we're going to have a big interview on Friday talking with Bonnie Armstrong about her mental health challenges and how they came about. And today I want to review an article that she wrote in the Permanente Journal on March the 1st, 2020, talking about, I've lost it. What's the title of the article? Talking about how, from a person who's suffering from mental health challenges, how she handled getting through a hospital and what medical professionals need to know about how to deal with dissociative identity disorder, also known as DID these days. We used to call it multiple personality disorder, and now they call it dissociative identity disorder. It's a condition rooted often in childhood trauma and offers guidance for healthcare professionals. Armstrong is a well-educated older woman with a successful career and family life. She describes how her DID, once called multiple personality disorder, manifests as distinct alters, as she calls them. These are the dissociative identities that emerge under stress, particularly in medical settings. These alters form to cope with childhood trauma and unpredictably shift her behavior, her voice, the effect that it has, and she can present as a 6-year-old or a terrified 11-year-old, which can confuse or alarm unprepared medical professionals. So in this article, and through a number of anecdotes, Armstrong illustrates the challenges of navigating healthcare with DID. In one instance, during an emergency department visit for dangerously high blood pressure, she warned staff about her condition, but the emergency physician dismissed her explanation, leading to a lack of understanding and then inadequate care. When her 6-year-old alter Jane emerged during a neurologic exam, the physician abruptly left, unprepared for the switch. In contrast, the paramedics and her primary care physician demonstrated trauma-informed care by listening, avoiding restraints, and engaging respectfully with her alters, which helped to de-escalate her stress. Armstrong highlights the physiological and psychological impacts of childhood trauma, referencing works like van der Kolk's The Body Keeps the Score and the Adverse Childhood Experience Study, which linked trauma to long-term health issues and dissociative disorders. She explains how her alters allowed her to live an apparently normal life for decades before her diagnosis at the age of 50, which followed years of misdiagnosed physical symptoms like muscle weakness and brain fog. Her healing journey involved collaboration with a skilled neurologist, a psychotherapist, a primary care physician, and a chiropractor who used trauma-informed approaches such as engaging specific alters to release somatic memories stored inside the body. The article emphasizes the superpower of disassociation, which enabled Bonnie's survival, and now aids her healing through targeted therapy and switching between alters. She underscores the prevalence of DID, often hidden due to its design to conceal trauma and the risk of misdiagnosis within trauma-informed care. Armstrong provides practical tips for practitioners, urging them to listen to patients with trauma-related diagnoses, engage respectfully with alters, respect personal space, and explore unexplained symptoms as potential trauma manifestations. Her story advocates for compassionate, informed medical care to support the healing of trauma survivors with dissociative disorders. The reason I summarized this article is because we'll have an interview with Bonnie airing at 11 o'clock on Friday morning. And I think it's a fascinating look into how childhood trauma plays out in the later years, especially for someone who had no clue that this had actually happened to her. Anyway, I will put the full article, my review of her article, on our website, and I hope you enjoyed this and pay attention to signals around you of who might be suffering from any type of mental health strain or stress or trauma. Have a great day.